Hey guys, and welcome back. Well, today we're going to talk about fibromyalgia and depression. Yes, depression. They run hand in hand, just like fibro and pain. Fibro and depression and anxiety also run hand in hand, unfortunately, too. Now, in fact, people with fibromyalgia are up to 3 times more likely to have depression at the time of their diagnosis than someone without fibromyalgia. Now, some research studies shows the effects of depression on the brain chemistry. Now, others look up abnormalities of the sympathetic nervous system. That's the part of the nervous system that determines how you handle stress and emergencies. Now, these abnormalities, they contend, may lead to the release of substances that cause more sensitivity to pain. Now, the result is fibromyalgia, when it's chronic pain and feelings of depression. Now, we talk about depression. What is depression? Well, depression is, it's a sadness. It's a sadness, and sadness is a normal reaction to the loss or life struggles or injured self-esteem. But depression surpasses sadness and becomes a problem that affects your whole life. Now, people who are depressed commonly experience loss of pleasure in enjoyable activities. What you used to do and what used to bring you joy, it doesn't anymore. You don't want to do it anymore. Depression can also lead to weight loss or weight gain. Now, people with depression, some stop eating and they lose weight. Some start eating and they gain weight. Now, low energy. Now, with depression, you're going to be fatigued out. And fibromyalgia, you already have chronic fatigue. Well, that depression is causing some of that fatigue. And feelings of guilt, sense of worthlessness. Thoughts about death. Some people with depression have thoughts about death, even thoughts about doing harm to themselves, and and you're gonna have depression not knowing what's happening to your body, because especially if you've been healthy and this just overtakes your body, you're living in pain every day, hey, you're gonna get depressed. Now, depression that lasts, like I said, depression, hey, it's a part of life, but it becomes clinical depression when it lasts for weeks at a time. There are other types of depression. Common types include chronic depression, bipolar depression. Some people even have seasonal depression, when you go back to daylight saving times and it gets darker earlier. People have, they've seen people be depressed because of the lack of sunlight. Now, what is the link between fibromyalgia and depression? Well, the stress from fibromyalgia, pain, and fatigue can cause anxiety and social isolation. Now, chronic deep muscle and tender point pains can result in less activity. Once you have this pain and you're depressed, you're not wanting to go anywhere. Some people sleep a lot. They're withdrawn. They don't want to be around people. It's also possible that anxiety and depression are a part of fibromyalgia, just like pain. And to me, it is. It goes hand in hand. Now, depression and fibromyalgia can greatly interfere with the way you manage your activities at home or at work. Now, so it's important to openly discuss any symptoms of depression with your physician. And I know I have felt very dark place with all this pain, and doctors not telling you what's wrong with you. And like I said, I hope you're not like me, but I've got diagnosed for symptoms instead of the whole disorder. Instead of saying, "Oh, you got fibromyalgia," "Oh, that's where your IBS is coming from. That's where your depression, anxiety." No, it was just finding one symptom, finding two symptoms, finding three symptoms, finding four, and then putting it all together, which was it's awful. But there are medicines that most people with fibromyalgia, your doctor may suggest for anxiety and depression. Antidepressants, sometimes they may even ask you to go to a psychologist. Anybody with fibromyalgia or any debilitating disease that concerns you with daily pain, you may need to go talk to someone. Therapy may be the answer. Yeah. And you may not have to be on medicine, but if you have to be on medicine, hey, anything to control and tolerate and help with your overall quality of life, hey, you go for it. You do it. Don't let any stigmas or any other people tell you what to do, because you're the one that's dealing with this pain and this sadness and this anxiety. So whatever is necessary, talk it over with your doctor, and hopefully he or she will come up with a plan that helps you. So yes, no, you are not going crazy. Yes, I know you cry a lot, and I know you feel sad and just think, oh, my life is, hey, that's that fibromyalgia. So you need to talk with your doctor, because that's that depression that comes with that fibromyalgia, and it's a chemical imbalance sometimes, and gotta get that fixed. So don't do anything drastic. You just go talk with your doctor, tell them how you're feeling, so they can give you some type of plan that you can treat your depression. All right, guys, that's gonna do it for me. Thank you so much for watching my video. I hope that you will like, share, and subscribe to my channel. And as always important, be blessed.